Okay, so we're going to get started with class for today. Just want to thank you once again for coming out and everything like that. So we're going to be dealing with 4 major points of CPR. What is it? When do you do it? Why do you do it? And how do you do it? Okay, we're not going to take all day. Hopefully be very efficient with the learning process for today. Okay, so the first thing, after teaching this for a long time, we get a lot of students that have taken this year after year after year. And every time I ask them to come in, they rarely understand or remember what CPR actually stands for, which is cardiopulmonary resuscitation. So I kind of have stopped in dealing with trying to make people memorize it, and I've been leaning on more simplification, trying to simplify things. When an emergency happens, it's not very necessary for us to, memorize the big words and things of that nature. We just want to kind of know what we need to do in a timely manner to save somebody's life or bring them back to life. Okay. So with that being said, instead of trying to memorize these words, although if you can, be my guest, you can just think heart, lungs, brain, okay? And you'll find these 3 words will come up over and over and over throughout the class with everything we're dealing with today, okay? Heart, lungs, brain. Can we say that together?
Heart, lungs, brain.
Exactly. It's very simple. Right? Is that hard to remember? No, exactly. Okay, so heart, lungs, brain, okay? So, we're going to just show you how dealing with the heart, lungs, brain is kind of dealing with these big words. So, the cardiovascular system to start with. As you can see here, this is the heart in the center of the chest, right? It circulates the blood, okay? That's what we're talking about when we say cardio. We're talking about the cardiovascular system, okay? The circulation of the blood, actually functioning as the transportation system to the body, okay? So what's happening here is this heart is beating, flowing blood through the lungs, transporting the oxygen that it picks up from the lungs to the various cells of the body, okay? So that brings us to our next letter in CPR, which is P, pulmonary, talking about the lungs, okay? Now the lungs, they deal with the main energy source to the body, which is oxygen. Okay, oxygen is the main energy source. The blood transports that energy source. Okay, if you think of it like that, you'll understand what's happening. Okay, so as you can see here, the blood is pumping through the pulmonary artery, going through the lungs, back to the heart. After that, it hits the aorta and gets divided up and goes to the various cells of the body. Okay, this oxygen that is transported by the blood has to get to every cell of the body, okay? Now, every cell of the body is relevant, okay? Your pinky toe, if you lose it, it'll be a problem, right? we need our kneecaps and things like that. But this is CPR, right? We're talking about life or death. If you lose your pinky toe, it's not life or death, right? And in this particular situation, it becomes life or death when the brain does not get the oxygen that's transported by the blood. It's life or death at that point in time. Okay? If there's a situation that prevents that oxygen from getting to the brain, then the brain will shut off and you will be considered dead. Okay? So these 2 organs combine together to produce oxygenated blood, and that's what the brain needs to function. Okay? It's just like saying this TV needs to be plugged into the wall. It needs electricity. Okay? If I unplug the TV, it's going to cut off. Is that right? Okay, so if I unplug this brain from this oxygen and blood, it's going to cut off. Can we agree on that? Okay, so if it cuts off, from that moment, when the brain cuts off, it doesn't just cut back on. There's no magic that's just going to cut the brain back on again. It doesn't work like that. Okay, it's just like if I unplug this TV, is the TV just going to cut back on? No, it's not going to cut back on unless I actually have to physically pick up the plug it into the wall, then it'll cut back on. I have to manually plug it back up, right? So, and that's what we have to do in this particular situation. We have to manually put back into the brain what it's missing, which is oxygen and blood. Okay? And how do we do that? With CPR, of course, right? We're going to press on the chest, flowing the oxygenated blood from the heart, right? I think we got a slide. Going this way. Right here. We have to press on the chest, flowing the oxygenated blood up these two arteries to the brain. Okay? Filling the brain back up with blood. That's going to do one of two things. One, it could bring them back to life, you know, if you're effective with the CPR. Or two, it could at least sustain the brain with oxygenated blood so that the brain damage isn't getting so severe that they're brain dead when the paramedics, the EMTs, the ambulance arrives. Okay? Now, this is 0 and this is 10. This is just an estimate. Okay? I know those numbers can be skewed. It could be 8. It could be 9. You know, whatever the case may be. Some of them say it's even 5. Okay? This is just an estimate. Okay? But just to give us an idea, every second that we're not doing CPR or the brain is not getting oxygenated blood, there's an increasing level of brain damage that would cause the brain to go completely dead. Okay? So the cells of the brain need oxygen. If they don't get the oxygen, they get damaged. Okay? Now, these cells, they control the nervous system. Right? They tell your arms to move. They tell you to see. They tell you how to walk and talk and everything like that. Right? So when the brain gets so severely damaged, you could be completely brain dead. That's one. Or you could have a very low quality of life after being revived due to brain damage. Okay? So if we want the person to have, you know, a quality of life, meaning we don't want them to be a vegetable, right? Then we need to try to save them as quickly as possible. Okay? Let's keep that in mind. Alright? So that's what CPR is in a nutshell. We're going to kind of do a quick review on that. I don't want to take too much of your time. What? It's an acronym that stands for cardiopulmonary resuscitation, but the 3 easy words that we're going to even remember to remember that is what?
CPR.
And words?
Cardio.
No, the easy ones. The easy ones.
CPR. Lungs, heart, lungs, brain.
Right, heart, lungs, brain. You see how it was even, you know, cardio, pulmonary. I even looked this word up, and we got a little definition. I think you look at it this way, right here. They didn't even have a definition for pulmonary. I looked this up. They were like, "Oh, do you mean respiratory?" I was like, "Well, why do they even use that word? You know, they don't even use pulmonary, right?" So with that being said, we're gonna make it easy on ourselves. Heart, lungs, brain, and the heart deals with what?
Blood.
The blood, absolutely. And the lungs deal with what?
Oxygen.
Oxygen. And what is it that sustains, revives, and ultimately, if the brain shuts off, we're going to put this into the brain and make it work again.
Oxygenated blood.
Oxygenated blood. Excellent. So, you know, become the expert. Okay? So, if the brain doesn't get oxygenated blood, what's going to happen?
You die.
Exactly. Heart attack, right? Choking, you know, is a long list of reasons, but ultimately it's going to deal with the blood not going to the brain or the oxygen not going to the brain. Okay? And if that happens, we have approximately, right? It's not accurate, right? We have an approximate 10-minute window to at least get started with CPR, okay? So this arrow, just keep in mind, this is, a representation of what would happen with the brain damage if we did no CPR at all. If we did CPR, this doesn't apply, and these numbers don't apply, because this is numbers of what will happen with no oxygenated blood going to the brain. Okay, if we do CPR, it's a little different, okay? After that, it's going to be completely brain dead. This is when, okay, we can't save it anymore. It's too late, okay? All right, so let's move right along. That's what CPR is, okay? When do we do CPR? Okay, this is the next one. By the way, if you have any questions, write them down in the comments section. We'll deal with them. Okay. Now we're gonna, if we have any questions as to when to do CPR, okay, this is an easy way of understanding. Once again, like I said, we're being efficient. When I first started CPR training, I would just play the video, and let the AHA teach you and everything. But I'm trying to make it simple. Okay. We do CPR when they're dead. Okay. Now, the question we should ask ourselves is, how do I know if they're dead? Well, 3 things: heart, lungs, brain. We're going to check those 3 things, okay? So the first thing we're going to check is responsiveness, okay? We just tap them on the shoulder. Hey, are you okay? They don't get any response. That means something's probably wrong with their brain. It doesn't mean they're dead, though, okay? And this is where the trickiness comes in with everybody who's getting certified. This is where a lot of people get confused. A lot of people get hesitant, and this is where a lot of people probably will walk away, because they're not properly trained. It doesn't take all day and all night to learn this, right? 1,000 of you on the internet, you're gonna learn this completely for free. Where to have a valid certification, you need to have it up to date every 2 years. But at the end of the day, if you can determine if somebody's dead, then it's time to do CPR, okay? Now, there's 3 things we're gonna check for: the heart, the lungs, and the brain. Now, we already said if the person is unresponsive, that's how we check for the brain not functioning, right? Okay, how do we check to see if the lungs are not functioning?
If their chest is moving or not.
Chest is moving, right. Chest rise and fall. Okay, is everything good?
Yeah, everything's fine. I'm just trying to make sure everything's set.
Okay, that's good. If there's something go wrong, let me know, because I can edit everything out, and I got another phone. Okay, so the next thing is the heart. And how do we check this? We're going to check this with the pulse check. I was supposed to be wearing my jacket.
Man, you might as well just keep going. You're already halfway into it.
Sorry about that. Alright, this is up right here. Okay. Maybe for the little thumbnail, I'll throw that in there. Okay, so heart, lungs, brain. Once again, no heartbeat, no breathing, no brain activity. That's how you know if the person is dead. Okay, they're completely dead. Okay, next up, any questions about that?
No.
Okay, so although it's very simple, it looks like it. This is a point that we very much in this class emphasize, because we just don't want anybody to be misled. For instance, like I said before, if you're unresponsive, you can be in a diabetic coma. You could have blunt force trauma to the head. The list goes on and on. It doesn't mean you're dead, because your brain controls your breathing and your heart. So if your brain is working on some level, then these 2 organs can probably work. Now, when this is cut off, then these, although they could have been fine, or one of them could have been fine, everything will cut off. They all work together, okay? So keep that in mind. We want to bring this body back, we have to bring the brain back. Okay, next up, why? Why are we doing this CPR? Okay, we're doing this CPR to deliver oxygenated blood to the brain to prevent brain death until the 911 arrives. Or they come alive. But we still want to get 911 there. No matter what the situation. Sometimes they come back and then they go down and things of that nature. Okay? Now, next we're going to deal with how we do CPR. Okay? And this is the first thing I want to pull up, is this one. Okay? A lot of people think your heart is over here, and right hand over your heart due to, pledge allegiance back in the day, right? But it's actually in the center of the chest. And we need to keep that in mind. If you look at the slide we just looked at, right here, as you can see, we want to press on the heart to flow the oxygenated blood to the brain. Pressing on the stomach won't do us any good, right? So we want to press on the heart. That's two major things that I want to emphasize more than anything, is knowing when to do it and having the proper hand placement. Because you will be wasting your time pushing on the stomach or pushing on the side, pushing too high. You want to be directly above the heart, okay? You want to push hard and fast at a rate of 120 compressions per minute. That's at a rate of 2 compressions per second. I mean, this is the speed we want to go at, right? Okay. The next thing I want to show you is this, right? This is the rib cage. Now, we want to be pressing down on the chest with the base of our palm, lining up from our shoulder to the base of our palm, just like that, okay? On this bone right here called the sternum, we want to be pressing on that. And that, of course, is where the heart is. But just keep in mind, this part of our hand is where the majority of the pressure is coming. We don't want to be pressing over here and over here with all that. We want to press squarely above the heart, but not even right here on the abdomen, where this is bone called a xiphoid process. We want to be above that. It look like it has a little groove right for your hand, just to perfectly do the CPR. Okay? Now, for adult compressions, it's 30 and 2. All right? We're dealing with one rescuer right now for CPR and first aid. For child, it's just one hand, okay? 2 hands on adult, 1 hand for child, and then for infant, we're gonna do 2 fingers, okay? So this is the method we would use for the infants, okay? 2 hands on the adult, 1 hand, the dominant hand, in which you have on the bottom. So if you're right-handed, you want that hand to be on the bottom, right, with the other hand on the top, pushing down, all the way down, letting the chest come back up to its normal position, filling back up with blood, and then continuing on again. Doing that 30 times, after that, doing 2 breaths, okay? Now, the important thing to know about the breaths is that we do a proper head tilt chin lift to open the airway so that the oxygen goes to the lungs. There's this divider in your neck called an epiglottis that divides the food from the oxygen. We need the divider to make sure it's going to the lungs, because that will allow the oxygen to mix with blood. All right, the stomach doesn't mix oxygen with blood, only the lungs, okay? And that's how we're going to get into the brain, okay? Now, a lot of questions that we have that we will deal with, but one of them will be the defibrillator, okay? Defibrillator, right? Okay, so this is a very confusing topic for a lot of our, novice, maybe just, lay rescuers, they call them. They're not necessarily in the healthcare field dealing with this every day, right? So how I look at it is like this, right? You know, and I know, you know, Matt, he's a paramedic. If you ever call 911, right? No matter if you're getting a Band-Aid or you know, just you could have had a headache. That's the first thing they're gonna do is put all these little pads on your chest. Right? Put all these little pads on your chest, right? And that's called an EKG. It's checking your heart rhythm, right? It's looking something like this, one of these little rhythm monitors, looking for the heart rhythm, right? So that's kind of like what this machine is. It reads the heart rhythm, okay? The only thing, it's not going to have any printout. It's not going to print out anything about your, you know, heart rhythm and anything like that. It doesn't do that. It's not as big, you know. It's very small, right? But it's scanning the heart, looking for fibrillation, right? Notice this machine is called the Defibrillator, right? The emphasis on the word D. I got that from Shauna, so if she sees this, you know, like, you know, emphasis on the D, right? Like if I was to deactivate a machine or something. If I was to de-escalate a situation, okay? I want to defibrillate. So I'm trying to stop the fibrillation to restore the normal rhythm. Okay? That's what the machine does. It scans, looks for the fibrillation. If it detects fibrillation, then it'll deliver a shot. Okay? Now, or you have to press the button for it to deliver a shot. It looks like this. For those of you that are on, you know, on the web, you can't see what I'm doing right here, so I'm going to show you up here. The same type of pads that are on the chest. Well, these will be a lot bigger. It's kind of similar to the EKG, but it's scanning the heart. You have to put it on the bare chest, right? You know, and the pads will tell you exactly where to place them. Normally, one goes at the, you know, on the shoulder up here, right here, below the collarbone, and one goes down here on the other side. Okay? Or this side or this side, but it'll have a picture. Maybe the right, top right, lower left. It's going to give a shot to the heart, okay? If the heart is fibrillating, okay? All right, so we're going to go over a demonstration on that in a moment. All right, now one last thing I'm going to deal with before we move on is the of course, we used to have a number one cause of death, that was heart disease, but now, of course, coronavirus is the number one cause of death. We had to update our videos and everything like that. Okay, so, you know, just to give a few things about the coronavirus that would be good is one thing that we're hearing. Vitamin D is very good for coronavirus. You know, you can get that from a lot of excessive exposure of sunlight. Okay, but for the most part, heart disease, coronavirus, and cancer, the top three causes of death. You know, they're kind of becoming a factor when you die due to the underlying conditions, right? When the person with the diabetes on dialysis or something like that gets COVID, or the person that, you know, is already kind of up in age gets COVID, or the person that, you know, has an obesity situation gets COVID. You know, so these are the reasons a lot of times that people die. Otherwise, people can beat it. It doesn't have to always kill you. Okay. Now, another thing about this heart disease is, you know, one thing I will say is bad for this is the fried food. You gotta stay away from fried food. Oil does not mix with water. That's why we don't pour it down the drain, right? But it's the same thing when our body is made out of water. It can clog our drains. The salt, you know, that's the next thing that raises the blood pressure. The main causes of heart disease are high blood pressure and diabetes, okay? Not sodium. You can get some natural sodium from the health food store. Salt, the table salt, the cheap stuff, okay? cholesterol, of course, excessive, pork and beef and all these different animal products, could clog up our arteries. That's where it comes from. It doesn't come from cherries or watermelon or, grapes and things like that. It comes from animal products, okay? So if we limit our consumption and have good exercise, good portion size, then maybe we won't have to have this problem. When it comes to cancer, a lot of the times you don't know you have cancer until it's already kind of very late. So the thing is, what I would suggest is, when you start getting about 40, just conduct yourself as if you have it. Because once you do have it, the first thing everybody does is they change their diet up. They stop messing with certain things. They have to go through all these things called chemo and maybe have surgery. But all of that is not even a factor unless you change the diet up. And then that's when they do it, but we could have did that 10 years early, okay? All right. So one last thing I want to deal with, for all the questions that we get out here for all these acronyms, on the CPR first aid video, FAST, right? Fast, face, arm, speech, time. These are the symptoms for identifying a stroke, okay? A stroke, there's two different types of strokes, typically. But it technically means brain damage. That's technically what it means, right? There's a hemorrhagic stroke, which is internal bleeding, right? Blood vessel may have burst. And there's ischemic stroke, which is a blockage, which is the same kind of along the lines with the heart attack, the blockage from cholesterol, the salt. It could be fat, it could, whatever the case may be. But at the end of the day, what it is, it's cellular damage to the brain due to lack of oxygenated blood being able to get to those cells. And what happens is we need to ask ourselves, what cells was that part of the body in control of? What cells did it send the signal down the spine to tell it what to do? Okay? And that's what happens. It affects the face on one side of the body. It affects the arm doesn't really work. The slurred speech, right? The brain functions for us to speak properly. The time, this means we need to get them to the hospital as quickly as possible so that they can do some type of medical attention so that the brain damage isn't permanent, okay? So let's remember that acronym, okay? So right now we're gonna cut it right there and we're gonna take a break and get into our skills portion of the class, okay? Thank you for listening, and we're gonna stop it right there. Okay, thanks. Okay, so now we're gonna do